Oh,
Oh,
yeah. Wow.
So that's got to ramp up a little bit here too, I think.
Yeah. And down in Chicago, I've flown through Chicago a number of times in the last month or so. Everything, all the restaurants are open in the O'Hare.
That's good.
Oh, that's interesting. Well, good evening, everybody. Thank you all for being here. I know this beautiful spring evening is probably one that you would love to be spending outdoors. So we'll try to stay very focused tonight to allow you to end as quickly as possible and enjoy the nice evening. But we do have some opportunities for you to share your thoughts with us, and we're really excited to hear what you have to say. So we'll start off with just some of our regular slides with showing the fact that we have on this committee a very, very diverse group of people, or the medical working group, I say, as opposed to a committee. And then I went through this weekend all the different things we said we would do, and we have been doing them. So I feel really good that the group has accomplished much of what they set out to do. And we did it keeping the values in mind as a part of the meeting and the guiding principles, because clearly health and safety and mental health and social emotional learning, as well as equity, have been significant parts of our discussion. And then when you look through our meeting timeline, you can see that the medical working group played a significant role in decisions that were made and when and how they were implemented, whether it was safety guidelines related to different stages of coming back to school, or guidelines and timing related to athletic competitions, the whole establishment of the Panther Pledge, a real focus on learning what we could about why people made the choices they made, because we did notice some trends that were connected to equity related to people and their learning modality choice. And then just last month, you gave us some very helpful feedback on cleaning protocols, and I'll get to the outcome for that in just a moment. So our purpose, as I said, we've been doing a great job in meeting that as a group, and I thank you for it. And there is no public comment. No one's registered to speak this evening. And then I'll just share a little bit about the data, and then I will pass it on to our facilitator, Drew Howick. So here you can see the Oregon dashboard, where we keep track of the number of students and staff, positive cases, and quarantines. We currently have 69 students in quarantine, but that number is, believe it or not, actually down from where it has been in the past. So it's all very positive. And if you look at the figures that are in the text box on the side, that all comes from our own member, Evan Fitzgerald, related to the data that he's keeping specific to the school district. So it's, as he said in another email, it's all good news, right? Is there anything you want to comment on, Evan?
Nope, nothing specific. That pretty much covers it.
Okay. And now I'll pass it over to Drew.
Okay, thanks, Leslie. Yeah, tonight's meeting is fairly straightforward. Leslie's going to talk to us about the outcomes of the feedback you gave at our last meeting a month ago. Brief overview of that. And then, as she said in her email, we just have 3 questions tonight, and they're more reflective kind of questions. First is, again, based on your expertise, what should the school district consider as they plan for the fall and beyond? As you can guess, the administration is already looking at all sorts of variables for the fall. And this is a chance, based on your expertise, to give suggestions, ideas, etc. The second is, if you look at all the things that you're aware of that the school district did during the past year, what do you feel should be amplified, continued, maybe accelerated, but just based on your knowledge of the district and your area of expertise, any thoughts you have about the school year in general. And the third and final question is, again, more of a reflective type of question as you look at what you have participated in the last 6 months or so. What has this experience meant for you? So it's more of a checkout kind of question, if you will, before we move on. As Leslie mentioned, this is the last foreseeable gathering of this group, although I suspect that you would be helpful and willing to participate if things required your attention in the future. But for now, that's our plan right now. So that's it. So we'll go back to Leslie and she'll talk to you about the April meeting and the outcomes, and then we'll dig into the questions.
Super, thank you. So we really asked for two things last time. The first was questions, reactions, or suggestions related to the health and safety protocols as they were currently being implemented. The second was input on the school district changing their cleaning and disinfecting guidance, which, based on your recommendation, actually did happen. We have updated our procedures for cleaning high-touch surfaces. And I noticed I did see Andy on the call. Andy, are you able to mention a little bit about the guidance that we gave our staff based on last week's meeting or last month's meeting?
Sure. We basically kind of, because the 1 in 10,000 possibilities of getting infected with the surface, we did reduce the amount of cleaning that we were doing between cohorts because it was negatively impacting the amount of time that we had to educate some of our students. And the other concern was, using too many chemicals and potentially creating an issue associated with bacterial resistant viruses and bacterial, but viruses that are not as easy to kill in the future. So we did take that step this last month, and everything seems to be going fairly well. As an option, we did buy spray bottles with soapy water. Kind of the CDC suggested that might be a way to help. And then actually using the soapy water allowed us to have students help us if there was a situation where we needed to clean something because it wasn't a chemical, the students could help us with that.
Thanks, Andy. I appreciate you just giving a little bit of an update on it. And then I'm also seeing that Jim Pliner's on the call. So Jim, there's nobody better to talk about prom than you. If you can unmute and tell us a little bit about the prom plans. Maybe he's not in a position.
There I go.
There he is. Okay.
I'm on the elliptical. I needed the break. I figured the health and safety group would appreciate that.
Yeah.
We've got prom this coming Saturday night. We've split our group into juniors, which will go 5 to 7, seniors 7:30 to 9:30, and that's to try to reduce the density in our outdoor venue, which is under a tent. The 7-day weather forecast seems to be cooperating with us. Our plan is to have everybody masking up. We're looking at welcoming students and again, asking them if they've done that Panther Pledge. One thing that I thought maybe we might be able to get some feedback tonight would be, we have never done temperature checks at the front door at the high school. That has not been a part of our practice. I assume that, there might be some reluctance among kids for fear of missing out to really give us a full and honest dive into that Panther Pledge. And so wondering what kind of guidance you might give us in terms of us employing a temperature check at the door. Otherwise, if the dancing gets a little too close, we've got to deal with our DJ that we will ramp it down and give reminders and do our very best to keep kids occupied outdoors and having a good time.
Okay. So Jim, would you like to invite people to give you some feedback on the temperature? Jeff?
if now is an appropriate time, I think that would
Sure.
be helpful.
Yeah, why don't we do that? Anybody have any reactions, thoughts on that?
I don't think that a temperature check is necessary, in my opinion. I think that external factors can make someone's temperature rise prior to even arriving to the tent, and you'd hate for someone to be, refused entrance to prom because, they had to run from the parking lot type of thing. I don't foresee temperature as being a very reliable indicator of COVID anyways, except for advanced disease. So I would say I wouldn't worry about temperature checks at the door.
Thanks,
I
Becky.
would second that motion.
I would agree with Becky. And also note that if it's like, it sounds like you're hoping as an extra step instead of or on top of the Panther Pledge. But if these kids aren't feeling anyway, they're probably going to be taking ibuprofen or Tylenol and they're not going to have a fever. So I just don't see that kind of battling that aspect of it either.
All right. That was helpful. And thank you, Mr. Pliner. I wouldn't have asked you to speak if I had known you were on the call.
Always happy. Always happy. I appreciate it.
All right. Then we're moving on to the questions, and I'll hand it back to Drew.
Yeah, we'd like to give everybody an opportunity to respond to this particular question in whatever amount of detail you would like at this point. So I'll just open it up for kickoff, and who would like to respond first?
I'll jump in. So something that has been on my mind and on the minds of a lot of people in the vaccine world, not specific to the COVID-19 vaccine, but vaccines in general, is that there's a fair amount of kids that have fallen off of the regular scheduled vaccine schedule and are hoping to try and make that up this summer. We'll see if availability will match the demand for that. But there's also going to be the concern of a new cohort of individuals that are becoming available for the COVID-19 vaccine. We saw that last week, where it's now down to age 12. That will more than likely go all the way down to possibly as young as age 6 months. And that might happen, it could happen as soon as this fall. Don't quote me on that, please. If that does happen, we're going to see another large cohort of individuals becoming available for the vaccine at the same time that they are scheduled to be getting other vaccines, at the same time that they're scheduled to be getting the influenza vaccine. And at this point, the CDC has not released information showing that you can get the COVID vaccine on top of another vaccine within a certain date range. More than likely, that's going to change by the end of summer. But once again, don't quote me on that. I'm not them. So something you need to think about is if you have vaccination requirements for going to school, it's going to become imperative to make sure that the availability of those vaccines is made for all of the students. And so kind of going above and beyond what you've ever done in the past, because more than likely there's been an access or availability issue that has prevented people to get to where they are, and they need to catch up. It's something that we've been talking about actually at the state level with DHS and the top epidemiologists there. So it's very much a concern.
Great.
Thank you. That's good information.
Absolutely. Yeah. Thank you, Brian. Good. Let's go to Amy and then Raven.
Hi. Yeah, a couple things that kind of come to my mind based on my just professional lens is just the continuous of our schools to look at trends of mental health and AODA use and abuse, and also the financial needs of our families, and really try to be as proactive as we can. So that I think means to continue to educate our staff so that they are aware of those things, so that they can reach out to student service staff or whatever staff that is, so we can continue to support students and families. And I think, coming in the fall, we might have more financial needs of families, more housing insecurity. So, and I mean, currently, I feel like over the past couple of years, there is an underreporting of housing insecurities of our families who qualify under that homelessness. So I think we really need to continue to work on identifying families who fit that definition so that we can support them. And I would also say the continued work of our equity within our schools and our district to make sure that every student has what they need and that we can continue to reduce barriers that get into the way of student academic success, I would say.
Thank you.
Yeah, thank you, Amy. Raven, and then Becky.
Yeah, I just wanted to mention, and this might go along with the second question too, but some of our students that have higher health needs that historically aren't able to come to school, I just wanted to mention that they have really applauded and OSD in being able to have access. So that virtual aspect has been huge for them this year, whereas there's this huge gap of access to learning for some of our students who aren't always able to be in the classroom due to seasonal influenza and those types of things because they were at higher risk of catching and having, worse outcomes. So I just want to make sure that we're continuing that. I think we've done a good job. But as we move forward, and that might not be on the forefront of everyone's mind, I just want to make sure that we are continuing that access for those students.
Great points, Raven. Thank you. Becky, and then we'll go to Evan.
Yeah, I think everything that everyone has said is on point. Keeping tabs on obviously the numbers is not going to go away. I think it's important to note mainly now that we've come so far with the vaccine and numbers are at a significant low, especially with hospitalizations. Obviously, that's my area of expertise, but knowing that number of hospitalized individuals, it doesn't necessarily mean that they've come from Dane County. A majority of my patients are from surrounding counties that are hospitalized at this point. And then also keeping tabs on, the number of, children that are actually physically hospitalized for this illness and adults who have had the vaccine, I've seen 0. So knowing that, if we have all of our teachers are vaccinated, staff are vaccinated, et cetera, and stuff like that. So I think just keeping tabs on the numbers, but looking at them with a grain of salt.
So Becky, did you say that the majority of people who are hospitalized are not from Dane County?
Correct.
Interesting.
Correct. And that's not a new thing that has been since November.
Okay.
So Dane County numbers aren't going to necessarily be correlating with hospitalizations.
Yeah. Okay, thank you. Evan, and then Alice.
So yeah, I'll build off what Becky said in terms of the numbers with a grain of salt. So, I think in general, as like the data professional, it'd be easy to say follow the data, but I think it's all pretty much baked in at this point. The effect of the vaccine seems to be tremendously effective. So, my myopic answer to this question is, I hope planning for fall of 21 looks a lot like fall of 19. So.
Right. Okay. Thanks, Evan. Alice.
Hi, there's been so many great points. I don't think I have a ton to add. I just and wanted to echo what Amy said about just the increased needs and, some disparities have increased even more over this COVID time. I keep going back to the information that was shared to us. I think it was in maybe January or February when we were looking at coming back and the differences in who was choosing to come back in person and who wasn't, and just being that we can keep really taking a deep dive into why and what would need to change so there wasn't that difference in desire to return in person. That's
Okay, great. Thank you. Erin, and then Beth. Maybe Erin's not with us.
No, I'm looking to see who else is here. Dr. Tempty is here, but I think other than that, we got through all of the group members who are present.
Okay. All right. Great. Thank you. All right, John, welcome.
Well, thank you. Work went pretty late tonight, so sorry I'm late. And this is on the question up on the screen right now.
Yes.
Yeah, I think the thing to be aware of is when we come back, we're actually already seeing it now. We've jumped from about 5% of the households in Oregon with respiratory infections to now 14 to 15% over the course of 2 weeks. When the kids come back in the fall, I suspect we're not going to be masking. We're going to be fairly well vaccinated, and you're going to have a lot of sickness out there. You're going to have kids who have not had a cold in 16 months, 18 months. And I worry to some extent about possibility of influenza this fall. Again, we count on the widespread of influenza to kind of naturally immunize children. I suspect it's likely to take off. The thing to keep in mind, I think, is the fact that the simple masking and distancing was 100% effective for influenza in North America and in Australia and New Zealand and South Africa and everywhere else. And I would have personally, if we see things taking off, I'd have a pretty low threshold to pull the lever to say, you know, it might be worthwhile to reinstitute masking for 2 weeks or, you know, move back to a 3-foot distancing just to see if we can alleviate some of the illness.
Mm-hmm. John, the prediction that there'll be increase in influenza and other respiratory diseases in the fall, is that because people have not had built up an immunity to those over the last 16 months?
That, and I think, you know, people are just going to be so happy not to be masking and distancing. We're going to let our guard down. But yeah, all the viruses are still out there. And once the engine is kids getting together, the whole thing is driven by the school year. And we've been in 14 months now of kind of an altered reality with masking and distancing. And that has really just put the brakes on everything. And once you pull that off, it's going to take off. I don't know if it's going to be worse than we've seen in the past. And it really depends on what influenza virus is around coming this fall. But Wisconsin and the rest of the country has never been very good about influenza vaccine for kids. We'll be lucky if we hit 30 to 40%. And most of the rest will be open. And the vaccines don't cover 90% of the other respiratory viruses out there.
Mm-hmm. Great. Thank you for that insight. Is anybody else in the group that I didn't call on who's here, but maybe whose picture I can't see? And before we go to question 2, is there any other comments anybody would like to make on what's been shared or any additional information on question 1?
I just wanted to add one more thing. I think that it's important also to keep in mind what other districts are doing. I think that, you know, Oregon students maybe would want to feel similar to what, you know, Stoughton or other districts around them are doing as far as when the fall comes and whatnot. So just kind of keeping everybody else in mind.
Mm-hmm. Okay. Good. Thank you. All right, let's move to question 2. What practices were implemented by the district that you're aware of during this last year that you would consider amplifying and moving forward? Maybe, John, we could start with you and just kind of go back to the order in reverse.
Well, I heard a rumor that the district might be a site for vaccination coming up in the next week or 2. Is that correct?
Actually, UW Clinic is offering appointments for our students. They've set up times just for OSD students to go in, and we filled it up dramatically fast. So we were working on getting more appointments opened up at the same site.
So judging on the way that works and how effective it is, thinking about that for influenza vaccines going forward would be kind of an interesting approach. And again, I'll just reiterate, so many of us were blown away by the fact that virtually all the other the other respiratory viruses pretty much stopped for the last 14 months. And that wasn't done with anything other than hand washing, masking, and distancing. And so going forward, just keep that in mind if there is anything bad in circulation.
Thank you.
Great. Thank you for that. Alice and then Evan.
I don't know that I have a ton to add to this one either. I think that it'll be interesting to look at in terms of the flexibility, especially for the older kids, what did work this year. I know that a lot of kids, my kids included, are definitely in-person learners. But I think that there are some kids, especially high schoolers, that are preparing to go off to college that will appreciate some continued variety and flexibility in their scheduling when it's feasible and appropriate.
Right. Good. Evan.
I guess I'll give an answer kind of from two perspectives. I think we talked about this before from a student standpoint. I think it's important, especially building on what John had said, that we make sure if people are sick and not feeling well, that we use all the technology that we now have available, so that missing a day of school is an easier choice than perhaps it was in the past. And then I guess I'll put a plug in for the teachers. I know that they found Wednesdays to be incredibly valuable collaboration time. And I mean, I don't want to see like shortened days or virtual days on a regular basis, but I know that they would love to have scheduling figured out so they can have kind of that collaborative work effort, whether it's between grade levels or between different subject education, that they can have that blocked off kind of uninterrupted on a regular basis. So I'll plug them for that.
Mm-hmm. Okay. Thank you. Becky and then Raven.
Yeah, I think that one of the greatest things that came out of all this was the Panther Pledge. I think that is a phenomenal way to have people held accountable for their symptoms and kind of stopping the spread at their home. But like John was saying, the flu, we saw zero flu this year. I think being in the ER, I don't think I actually had one positive flu case in any of my patients, which was, I've been in the ER for almost, 18 years and that's never happened. So the flu will come and it will be bad probably. And kids, it's going to mimic COVID. So I think having a plan in place, if you have vaccinated kids that have these respiratory symptoms, kind of figuring out what your length of quarantine is going to be. If you're going to require testing, kind of those are all guidelines that I think the CDC will have to, figure out for school-age vaccinated kids. But right now they're saying we don't need to if we're vaccinated. So kind of just having a plan in place for when that does happen in the fall.
Mm-hmm. Okay. Thank you, Becky. Raven and then Amy.
I have nothing new to add. Dr. Temte, you read my mind about the flu vaccine. And with Brian saying too earlier about the lag in vaccinations and making sure we're getting on top of our student vaccines, I think that would, if we can implement that, a flu vaccine clinic, that would be awesome.
Mm-hmm. Okay, thank you. Amy and then Brian.
I think it's been nice how the district, our student service department district-wise has been able to survey, assess, and screen students K-12, and we've been able to kind of drill down on certain social emotional aspects of where our students are, and then meet those students where they're at and provide intervention as needed. So I think that is something, I know some of those things were in place even pre-pandemic, but I think we really rose to the challenge and were able to create some assessments early on as students were coming back so that we really had a good baseline of students. So I think that is something to keep in mind. I think the technology growth of our students and staff have been, tremendous. And I think to continue the technology with our students is great. A lot of students really, I'm more 712, but that Google platform, I think for everything to be housed in one place was really helpful for our upper level learners, is a great way to teach them kind of a way to organize their schoolwork and how teachers organize that in the Google. Parent-teacher conferences, I think that the way those were held this year were really beneficial to students and parents. They were more collaborative among disciplines so that teachers, it's one student with multiple teachers and parent or guardian attending those. And I think those are a really valuable way for our staff to collaborate with one learner and really meet the child where they were at. I think that's what I got.
Okay. Thanks, Amy. Brian.
Yeah, I've got a couple of things. So first off, I think, it's been said here, but, my wife is a professor, and there's been this drastic change from going from in-person to online. And I think, there'll be a drastic change going from online back, but there's certain aspects of what's been going on with the online teaching that has been an enhancement on the overall education opportunities. And I want to see, I couldn't list out what those are because I'm not a teacher and I'm not in that role, but I'd imagine as a teacher, there are things that you are taking away from this and saying, I am never letting this one go. At risk of becoming really unpopular, I could see snow days becoming a thing of the past because it is now, you can do this virtually if needed. So there's that. I think separate point, I will plug that I think so many people have learned the basics of epidemiology in practice over the past 14 months that it would be a shame to see those tools and that knowledge go to waste in the future. There's so much shoe leather epidemiology that's been going on right now between contact tracing and quarantines. These are things that we can apply in the future, either for COVID or for influenza or for whatever else were to come out. We have the skills and we've proven that we can do it, so we might as well keep those processes in motion. And then I will just once again reiterate the points that have been brought up by Becky and John, is that when it comes to influenza, vaccination is probably one of our better tools against it outside of the social distancing and the masking. And when it comes to vaccines, it is everything about bringing the vaccine to a person rather than a person to the vaccine. So any way we can make it easier, have access and availability no longer be an issue, or even cost coverage somehow. Those are all things that will help reduce the overall burden of that disease in the future.
Mm-hmm. Great, thank you. Any comments on the comments? I'm going to do some more research into shoe leather epidemiology. That's a great one, Brian. All right. Leslie, do you or staff members have any questions or comments on some of the ideas that were just shared here to the last question for board members?
Well, I would just say that it's pretty nice to know that some of you are suggesting things to amplify that we suggested to the school board at our school leadership team meetings. So I think a lot of the experiences that you are reflecting in your thoughts on this were the same ones that we had. So it's very nice to see.
Yeah, I was going to reflect that too, Leslie. We had a 4-hour leadership team meeting from every building with the board a week and a half ago, and it was really an exciting session to learn what we've all learned through this pandemic. And to Brian's point, what are the things that we need to hang on to that will take us well into the future. So thanks for bringing those points up.
And Evan's point on collaboration was one of our major themes for the presentations. So, for sure.
Great, thank you. So our third and final question tonight, as you can read, is as you reflect on the last 6 months, your participation in this group, you have shared information, which has been very valuable. And I suspect you might have learned some information or had some kind of experience, something that was meaningful to you. So we'd like to just have an open forum and have you share what has been meaningful or what this experience has meant to you. We'll just let whoever speaks start us out.
I can go ahead and start.
Thank you.
It's been really nice getting to know all of your little inch faces on my screen, but you know, I'm kind of stuck in the hospital world, so it's been really good to see kind of outside those walls, everybody else's perspective on things, and then with the added bonus of getting this district in there. You know, we recently moved to Oregon, and I have a son in 4K, so we're just, you know, babies in the district. So it was good to kind of start off this way, unfortunately, with COVID. But yeah, I've really enjoyed it. So
it sounds like this accelerated your opportunity to get to more people, know more people in the community, and
correct. Yep. I mean,
yeah.
if I see it, you know, as long as we have the mask on, though, I might not recognize you.
Great. Thank you, Becky.
I can go next. I would just say I just love this interdisciplinary approach to like looking at a problem, looking at situations, and I would agree, just that increased knowledge base that I've learned over the last 6 months. And I appreciate the process, and everyone's just so insightful. And I love to hear other people's perspective, because I do believe that makes us better in our, you know, in our own practice. So I too have enjoyed it, and I just love to like increase my knowledge base and make connections to other people, but just the whole format and the questions were really thoughtful, and I think it really was helpful in our discussions.
Great. Thank you, Amy.
And I'll jump in as well, and just you have to, you know, give a shout out to the members of the board, the people on the from the school administration. And then just kind of the wide variety of thoughts. And I think everybody was very respectful, very thoughtful. And it really felt that the school board were taking the information, processing it appropriate, and applying it. So thanks to everybody.
Great. Thank you, John.
Yeah, I'll add in, I guess, thanks for letting someone who has no direct knowledge on this stuff be a part of it, and any part I could have played in helping get kids back in school, I'm very satisfied to have been a part of that. Also, huge thanks to Dr. Bergstrom. You started the very first meeting saying that the whole point of this group was to try and figure out how to get the kids back in as soon as possible, and you lived up to that bargain from the beginning. As much as I've enjoyed it, with all sincerity, I hope we never have to meet again and we can see each other at some other function.
Yeah. Thanks, Evan.
I'll just say I appreciate the transparency. I think, you know, as you said, we feel like, you know, our words are being heard here, but these are decisions that did not need to be made in a public forum like this necessarily. And I think a lot of organizations across the country chose to go a different route. And I think that having this be open builds more confidence in the parents of the school district, of the staff, and the students if they understand it, and certainly builds a lot of confidence in me personally knowing that someday if I have a kid, you know, it'll be going to the school district. And so I do appreciate that. So thank you.
Okay.
I can go. I feel like like a lot of good group experiences, I got more than I gave. There's people on here with amazing expertise, and it's been really interesting to listen to and just to hear the way that people think about this really important issue. I, like Becky, am newish. We moved here just under 3 years ago, specifically to be a part of the school district. And so it makes me feel proud to live in a district that does things thoughtfully and with a superintendent that is incredibly thoughtful about decision making too. So thanks for letting me be a part of it.
Thanks, Alice.
Yeah, and I'm just appreciative that Leslie and the district even thought to create this medical working committee and was able to bring professionals from all aspects of healthcare, from epidemiologists to mental health, physicians. I just think it was wonderful that we were able to collaborate and make those decisions as a group. So thank you.
Great, thank you. I'm going to ask if Krista and Tim would like to answer this question as well. They have been two of your board members who have been with you for every meeting. We meet at least once before each meeting talking about what we want to accomplish and what are the questions and how to structure the conversation. And they've been very instrumental in helping to make these meetings as efficient and as productive as possible. But Tim and Krista, if you'd like to ask comments.
I can say a few words. I too, all the things that everyone has said with regards to, the interdisciplinary part of this group, I think has been very important to me. We talked quite a bit about both the mental health as well as the physical health and well-being of not only the kids in school, but the educators, and equally as important, the community. I think across the board, that interdisciplinary approach was super important for this community, frankly. We talked with folks who had young kids in the district and were also professionals on this group. And we talked to people who don't have any kids in the district. And I think that too is important. Because again, everyone brings a unique perspective to this group, and it can be a little cumbersome at times. But I think we sifted through that cumbersome possibility very early on, and we were able to get a lot done in an hour and 15-minute meeting on a pretty regular basis. And so I truly appreciate the time people have spent here. I have gotten a lot more out of these meetings than what I put in. I usually am pretty quiet in these meetings, and I'm just absorbing because we have other board members who are asking what's going on. We have other community members who are asking what's going on. And frankly, I've had other districts board members call me to ask what's going on in this group. And I'm very proud of not only having the district put this group together for us, but being able to participate in it. And so it's been very valuable for me, both as a community member, as a parent, and as a board member.
I'll just say thank you. You're all very, very busy people, and we took a lot of your time over the last few months. So we really appreciate you coming into this group. And I hope going forward that, that this is a long tradition of the Oregon School District, that we invite people in for input on task forces, groups, Visioning Summit coming up in June. So I hope this is only the beginning of your involvement with the Oregon School District, whether you're a parent or not a parent yet, or have kids that have graduated. We love to have input from the community because it makes us stronger. And we've always believed that. We will believe that well into the future. So hopefully if this is your first entree, we hope there's more to come. So thank you.
Great. So I think it's back to you, Leslie.
Thank you. Just a couple of thoughts to share. And the first is there is no set next meeting. However, if as the summer goes on, if the CDC is unclear or public health is unclear, I know who to call. So I will definitely be coming back to my medical working group if advice moving forward lacks the clarity that we need within the district. So, I even wrote it exactly that way. And then just for my own closing points, the idea of being very grateful to all of you, and grateful to the fact that all of what you own, in this quote from Voltaire, you were willing to share with us. And that was your time and your professional expertise, and sometimes even just your points of view as parents and community members, because it truly does make us stronger. And I never really thought about it in the way that Amy put it, as an interdisciplinary approach, but it really is, because if you look at our apple, the center part of our apple is the whole child. And in working toward the betterment of the whole child, that requires a constant interdisciplinary approach. And so the medical working group and all of the areas of expertise that you so graciously offered for the betterment of our students and the community, that was really about bringing all of those points of view together to support what was best for the whole child that's at our center. And we do have a long history of reaching out and becoming stronger as an organization and stronger as a community, because we're all willing to help one another, in service of something greater. And the thing that is something greater, it's our children. This is all in service of them and giving them the best and the safest experience possible. So thank you all. Your time really has meant a lot to us, and certainly has helped us get through some very challenging times.
Okay, I think that is a wrap, unless anybody has any pressing announcements or jubilations or at this point. Okay, hearing none, seeing none. We this next 30 minutes is our gift to you. How's that? All right.
Great.
Enjoy the evening.
All right.
Thank you
Thanks
so
so much.
much.
Good night.